everyone, my name is Erin Bishop and my informative speech today is going to be about how to do the process for field triage rapidly. So have you ever wondered why anybody in the medical field or how they do rapid triage? So we use it a lot in combat. We can use it when there's mass casualty incidents. A mass casualty incident would just mainly make up more than one patient than you're able to take care of by yourself at one time. It could be because of the injuries, or you're just unprepared, not equipped as if you had wanted to or would like to be planned to have all the supplies with you. Rapid triage in the field is just a process on how to assess patients by their different injuries and the different areas as to where they need to go into the different sections of the triage process. That way they can get to a higher echelon of care. So that would just mean to a better facility where the injuries can be taken care of, surgeries performed, or you have the ones that have scrapes on them, and those patients can become part of your manpower team that helps you out with your other patients or lifting patients or taking notes. So not all of your injured patients are going to be patients that are incapable of helping you out during a large chaotic incident. So the different groups that we have with the triage is going to be the immediate, there's minimal, expectant, and delayed. So those are all different areas and they consist of different injuries and how quickly the patient's going to deteriorate or how bad a shape the patient is in, and then that also tells the rest of your team how quickly they need to get out and get to a higher echelon of care. So when you start your rapid triage, you're going to come up to a scene of a lot of injuries, or it could just be one that's really bad, and then that's where all of your attention needs to go to. So I have the red team, and that can be labeled for the immediate. Those are going to be your patients that have no radial pulse, or they have a cap refill that is greater than 2 seconds. They have airway compromised issues, or they're covered in burns, so that means that they're going to deteriorate rapidly, and that patient could die right then and there, and you want to get them out of there as fast as possible. So we have one casualty that has burns that's going to be a bad case, so you want to get them out to a higher echelon of care so that way their life expectancy is better than what it would be just lying here. Then we have minimal, and that would be a green team. And so that would be scrapes, minor cuts, maybe a broken finger. This patient's going to be cooperative. It could just be like a simple bleed. And then the patient right here, it has a bone poking out the femur, a little bit of bleeding, but it's controlled. So this one isn't going to be as bad, so it can be minimal. It's not as high of a priority, but you're going to need to reassess it. So that's kind of what you're looking at for rapid triage. And then you'll have a yellow team, which is delayed. So those will be the patients that are the walking, talking, and they can become part of your team that's going to help you out. They can help take notes. They can help treat your casualties. They can do anything that you need them to do once you bandage them up and take care of them. And then you have the expectant, and those are the ones that you know are not going to make it. You sedate them and give them medications as quickly as possible to just make them feel the ease, so that way they can expire or pass without as much pain. So those are the different sections of triage. It's done at a very fast pace, rapid. That's why it's called a rapid triage process. You want to get these patients, you want to look at them head to toe very quickly and assess the more injured. That way you can get them out the door and get them to that higher echelon of care. And so after they're triaged, when they come into these sections, they're treated, they're taken care of, and then they're just waiting on their transportation, whether it's by air or by casevac. And then that's just getting them out to higher echelon of care, as I talked about before, and that way their outcome is better. These casualties also, they're going to get a casualty card. It's going to list all of their injuries, different things that you've done for them, and then just different demographics that are going to go on with them to the higher echelon of care. So this is just a real quick way of how you do the rapid triage in the field. Let's hope that none of you guys ever have to do this. So my audience with this, 2 of them were children because it's easier for them to lay still as patients, and then the camera guy is also my 3rd member of my audience. So I hope you enjoyed. Thank you.